Actually, you can go back into ancient history, and there have been catheters to relieve, and the medical condition we're talking about here, by the way, is called urinary retention, as in you're retaining your urine and you don't want to because you've had a blockage or there's some other problem. The opposite of retention is incontinence, which means that you don't want to go, but you can't control and you have an accident. Yeah.
Right. Right.
But retention is medically much more serious, and it you can actually find in ancient history all the way back to the ancient Greeks, where they were using literally straw reeds to relieve that pressure and tension. Into the 16, 1700s, they used things like gold and silver tubing to put up the urethra, again, in order to relieve that pressure. Now, the Foley catheter was invented by a guy named Foley, not surprising, around World War One, and this was because there were an awful lot of men who were in hospital beds having been injured, and they needed a way to relieve themselves. So, for those patients, and even today, most people, if they go into hospital for a procedure, will get a Foley catheter put into them for a temporary period of time. But over the past roughly 100 years, we've all become more mobile. We're getting older. And so the Foley catheter is used now in community settings, ambulatory settings. And it's a big problem because if you use it just for a couple of days, that's one thing. But if you use it for a long period of time, what you're doing is opening the body to a risk of infection, basically creating a superhighway for bacteria to get up into your bladder. And that is not only bad for the patient, obviously, but it becomes a big burden on the healthcare system.